So hello, my name is Sarah Luttrell. I'm the Communications and Events Manager at the Center for International Development at Harvard University. I'm excited, as the rest of you are, for today's discussion on a temporary basic income during COVID-19. The format of today's discussion will be a 15 to 20 minute presentation and around 20 minutes for question and answer. So you'll all be able to ask questions of the speaker towards the latter half of the event. Before we get started, I also want to mention a few housekeeping items. For the Q&A, we just ask that you submit your questions directly into the chat or by using your raise the hand function so that you're able to ask your questions directly to the speaker. We're also recording today's session, and the recording will be available on CID's YouTube channel. I will add links in the chat for signing up for our newsletter and our social media channels to hear more about events like this. And finally, next week for our CID speaker series, we are featuring Michel Ruta, who is a lead economist of the World Bank Group. He will be discussing the economics of China's Belt Road Initiative. And we hope that you'll all be able to join us for that event as well. But without further ado, I would like to introduce our speaker for today, George Gray Molina. He is Chief Economist at the UN Development Program's Global Policy Bureau. His policy and research work focuses on poverty, inequality, and policy reforms in the developing world. He has over 20 years of experience in government, the United Nations, and academia. So George, thank you very much for being with us today, and I will hand it over to you.
Thank you so much, Sarah, and thank you so much, everyone. I'm delighted to be here. I'm a graduate of the Kennedy School. I graduated 26 years ago in 1994. So I'm doubly delighted because of that, but also because at that time, something that we learned and that sticks with me is that most development achievement is slow and cumulative. It's hard and difficult. But once in a while, there's a window of opportunity for rapid change, for transformative change. But even those moments, those windows, are faced by constraints. They're fiscal, administrative, political. So what I'm gonna share with you today is one of those moments. You know, the window has opened through the COVID crisis, and governments are reacting to the crisis with different kinds of policies. So one of them is a basic income policy. And at UNDP, what we wanted to do, and we started to do in the month of March, was to think about the distributive effects of different kinds of policies. So what I'll share with you is sort of work in progress. It's about implementation, and it's about on the ground action. But I hope it inspires all of you to think about some of the big challenges in the developing world. So I'll ask Sarah to help me out with the first content slide. Basically, I'll be sharing 3 ideas in this presentation. The first one has to do with TBI scope and challenges, just sort of the big picture, what countries are already doing on the ground. And then second, maybe share with you some of the implementation issues that we've seen that mostly have to do with administrative rollouts and digital rollouts over the past few months. And finally, I'll talk to you a little bit about TBI graduation, because as we imagine this and as we move forward on this, we see this as a temporary response to a shock. So it can last 6 months, as it has in many countries around the world, or it can continue for 9 or 12 months. So that's sort of the scope of the presentation. So let's move to the first section on TBI scope and challenges. Thanks, Sarah. You can move all the way up to the maps. There's a map coming up. Next one. Thank you so much. All right. So the motivation for this is that in the month of March and April, as we saw sort of the height of the COVID impact in most of the world, close to 4 billion people in lockdown, what we also saw was sort of amazing and quick responses coming from governments. The maps that you're seeing here are sort of on the wind down phase from that response. So you've got on the left side, you've got August, and then on the right side, you've got today's view of income support. And as I'll discuss in the next few slides, these reflect different kinds of policies, which we've bunched up in 3 kinds of models. So there's sort of the European model that works through work furloughs. There's the North American or the US model that works through unemployment insurance. And then there's the developing country model that works through emergency cash transfers. So we'll take a look at how those interact, and that's sort of the scope of how countries have reacted over the past few months. But as you can see from the second map on the right, many countries are winding down, and that's something that we are concerned about because of the length of the COVID impact over the next few months and years. So let's go to the next slide, please. So the question posed is when is a TBI warranted? When is a temporary basic income warranted? And what we focused on early on in the response is to see which countries had social insurance policies in place, in which countries needed to simply top up or expand existing social protection schemes. So as I just mentioned, we have sort of two of the working horses, if you will, on social insurance are the German model on work furlough and sort of what we've seen here in the US with unemployment insurance, coupled with emergency cash transfers as the $600 per month that was in place until August of this year. So that was happening in the advanced economies, but for about 130 economies, none of this really was in place. Why? Because most labor forces are informal. So social protection is usually linked to formal work setups. And if you have 60, 70% of the workforce outside of the formal workforce, they have no social protection. So what did those countries do? They started to roll out emergency cash transfers based on the existing cash transfer models. And that's sort of where the challenge is. As you roll out and you try to expand and top up, you find that you're missing, that the errors of exclusion are quite massive. They're in the tens of millions of people around the world. And this can have a tremendous impact over income and poverty rates for the next few months and years, frankly. So let me show you three of the options that my co-author and I wrote up in the month of May. So we'll go to the next slide. We worked this up with Eduardo Ortiz. He's a Mexican economist working in King's College right now. And what we focused on with him were three options. One is what we call the top-up option. So many countries already have administrative registries on which they have tabs on people who receive conditional or unconditional cash transfers. So you know what the market income is, you know what the additional cash transfer is, and you can measure what a top-up would be. So we set this up with three thresholds for different kinds of countries. Very poor countries with a $1.90 poverty line, we used a $3.20 per day line as a TBI threshold, so above the poverty line. For countries that had a $3.20 poverty line or close to that, we suggested a $5.50 TBI. And for those countries, many in Latin America or in Europe, where the poverty line is closer to $5.50, then we propose a $13 line. So these are sort of the standard lines that the World Bank uses and that most of us use in the UN system to look at different thresholds of poverty and vulnerability. So the top-up approach is simply using the existing administrative registries and topping up based on that. The second and third options are the tough ones, and they come into play when countries haven't been able to reach out to the full extent of their population. So it's either lump sum transfer for people who are outside of the administrative registry, or it's a lump sum adjusted by cost. So we do estimates and we do simulations for all three of these, and they give us sort of ballpark figures of where the TBI debate is. So let's move to the next slide, please. And this gives you, the next slide gives you a sense of the cost. And of course, the cost is large. It's about $299 billion per month for a TBI for 132 countries around the world. When we sort of compare these, of course, the top up will be less expensive. The lump sum will be the most expensive. And in between, you'll have the lump sum with cost adjustment, which has a different price tag. But let's look at the next metric on, next slide, please, on what this means in terms of GDP per capita. As you know, fiscal stimulus packages are very heterogeneous around the world right now. So closer to the advanced economies in Europe and the US, you get fiscal packages of between 10 and 12% of GDP. You get non-fiscal packages that are even higher that have to do with liquidity and monetary policy through central banks. But in the developing world, the fiscal response has been muted, and it's muted because of fiscal space and debt constraints. So we see increases between 2 and 4% of GDP. So that's the range in which countries are already responding. So how much would a TBI cost? The top-up policy is about 1.6% of GDP globally if we were to implement this with different rates, with different poverty lines around the world. And then it gets more expensive if you focus on the 9-month period, 2.5, 2.4% of GDP or even further. But when we were discussing this and we were at the UN at the very same time, the G20 was having a debate about debt moratoria and debt standstill, which came into effect in April of this year for 71 low-income countries. So those countries can stop paying their external debt for the next few months until the month of December, and use those resources for income support. And that's been happening for a number of countries, but that leaves out about 90 countries that are middle income countries, that are small island developing states that are not eligible for a debt moratoria, a debt standstill. So at the time we were writing this paper, what we did is benchmark the size of a global moratoria for the developing world, which is about $3.1 trillion this year. So this year, 162 developing countries will pay $3.1 trillion to creditors on debt that has a stock of $11 trillion. When you break it down from the 3.1 trillion, about 2 trillion is short-term debts, less than 12 months, and the rest is long-term debt of more than a year. So you get sort of the scope of what that is. This would cost, as I said, it's about the equivalent. You could pay 3 times the TBI for a 6-month course. In other words, 18 months of a TBI with about half of the debt moratoria for the developing world. So let's go to the next slide, please. On regional coverage, as you can expect, there is a lot of diversity here. Most would be focused in South Asia and Sub-Saharan Africa, but there is still a sizable proportion of people under various poverty lines in Latin America, Europe, Middle East. I think the interest here, we had a launch in the month of July, and we discussed with many governments on how they were seeing this. And of course, the issue is there's a mismatch between the fiscal space that countries have and the need to respond for income support. No country is able to mitigate the full GDP drop. No country in the world, in fact, the US or Germany or any country. But many countries can mitigate either the job loss or the income loss. For economies that are highly informal, what is at play is mitigating the income drop, because the job market has has been described more or less as a W during partial lockdowns, more severe lockdowns, and a relay of that. So that's sort of what we've been seeing over the past 6 months. Let me show you the last slide on regional estimates before we get into implementation. So this is just simulations for the European, some European countries on $13 a day. What we were doing here is just focusing on what would this mean in terms of percentage of GDP, which is smaller. So you get, for most upper middle income countries, a TBI cost less than 1% of GDP. It oscillates between 0.3 and 0.9%. So let's move on to implementation, which is the tough thing. And we'll start with the next slide, please. Thank you. And what we see with implementation challenges is that countries around the world are already going through these 3 phases that you see here that are sort of drawn up as amoebas. The first one is easy to see, which is the eligibility criteria. And that's usually done sort of, it's a desk job, if you will, of the type that we did in this paper. The tougher issue is actually the enrollment and registration of people. And we've found some very impressive cases like Togo that in the course of 6 months registered about 1/3 of their population through SMSs and did it all digitally using their own cadastre and census data for geographic location and for filtering locations that had more than 80% poverty in those neighborhoods. As you can imagine, all of this was done in haste in most countries, so that we have a lot of exclusion error and some inclusion error coming out from the expansion of cash transfers. The second phase is the payment phase. So we've seen sort of three instruments here. The first is digital payments, and this has already been in place for years around the world. Second, we see increased use of mobile money in some countries that can match up cell phone availability with mobile money. And third, in some parts of some countries, we continue to use cash. So the three modalities are being rolled out for about 130 countries right now. And then, of course, there are many countries that are thinking about graduation. And graduation in this context is different from poverty scheme graduation, because this is temporary. This is about the labor market, the ebb and flow of the labor market. And I think I'd like to come back to just the big picture right now in terms of timelines, and something that the World Health Organization is helping us sort out, which is, so when will it be safe? When will we have sort of massive vaccinations in place? We know that the COVAX initiative is aiming at having 2 billion vaccines ready by the end of 2021 for most of the developing world. But it's probably going to take us until 2022 until we see the full rollout in the developing world. So by mid-2022, we might see a full reopening of economies based on the fact that we don't have to have partial lockdowns or even engage in social distancing by then. But as you can imagine, that's almost 2 years away right now. It's about 1.5 years away. And right now, many countries are already rolling up and graduating their temporary basic income scheme. So this will play out differently in different countries. You can even follow the debate and the discussion here in the United States. There was a $600 a week policy which was an unconditional cash transfer until July 31st, and that's now stuck in Congress. So we'll see the effects of that playing out for millions of people, even in the US, and that has an effect on the poorest and most vulnerable people. So multiply that by multiple fold and think about countries like Brazil, Egypt, Nigeria, the largest economies in the world, India, that are also addressing the question of when to taper down income support for households and for people. So let's move to the last point, which is graduation. And we'll go to the next slide. Thank you. So as I was mentioning before, those of you who are working on poverty, on extreme poverty, on multidimensional poverty in developing countries know about different graduation schemes. And sort of the idea is not to release a conditional cash transfer until certain conditions are in place, including asset ownership, including access to skills and education, and sort of a graduated and tapered way out of poverty. In this case, for the TBI, what's of concern is the labor market and how quickly it rebounds. And this includes informal and informal, so it's livelihoods in rural agricultural sectors and non-agriculture in the rural areas. And in my own mind, I think what this is pointing out, this sort of in the big picture, is that although in the developing world we've been quite good at advancing conditional and unconditional cash transfers, we've been less good at addressing social insurance. So those two arms, if you will, social assistance, which is cash-based, and social insurance, which is usually contributory, it's something that employers pay into or employees also pay into. So those two arms should be sort of the setup that you would require for a dynamic labor force, so that you can have economic growth. It's based on labor mobility and a lot of the dynamism that we've been accustomed to in the developing world. But I think this sort of the COVID episode is telling us something about this lack of social insurance. There is a parallel debate that I'm sure many of you have engaged in, and which we are also engaged in the UN system, which has to do with universal basic incomes, and to think about what does that mean for certain countries at certain moments in time. And there's a big debate about that. As you know, that transcends ideology. It's been sort of a staple for labor parties, social democratic parties for decades, but it's also been on the agenda of people like Friedman and von Hayek and Nixon, thinking about negative income taxes. So we see an interesting debate on income support and universal basic income. In my own mind, I think that this discussion is important, but it's probably more important to see how we can use these instruments that are contingent upon contingent issues. And one of the things that we're looking at right now is carbon dividends and thinking about carbon taxation in the future and ways to compensate populations during the transition as transportation costs rise. How do you create quick mechanisms of compensation during the energy transition, which will be very important to meet the Paris climate agreement target. So that's the kind of thing that we're looking at right now. And a second group of us are also looking into gender and the care economy and thinking, well, maybe basic incomes and the graduation from basic incomes can stay on for women as compensation for unpaid care labor, which is a large proportion of all of work around the developing world. The incentives for labor participation are skewed against women during working age, and the gap is between 20 and 30%. So what can we put in place? What sort of incentives, what sort of nudges move beyond regulation and make some of these transitions smoother? So that's part of what's on the debate, that's in discussion right now. I guess I'll wrap it up here because I know that you all have your own interesting experiences and comments on what's happening right now. That last slide is just for you to take a peek, take a look at this paper. We'll be writing some follow-up papers on this because we think that this agenda, the income support issue has not gone away. It's still with us. It'll be with us probably till 2022. So we can have this conversation maybe in 12 months' time and see how the world is doing in terms of income support. But for now, thank you so much. And I'm happy to answer any comments, questions as we follow up. Over to you, Sarah.
Great, thank you so much, George, for that presentation. And if anyone has any questions, please feel free to raise your hand. And I have also posted the link to the paper in the chat. So any clarifying questions or additional questions for George are welcome. So Kareem, if you'd like to ask your question.
Yeah, thank you very much for this presentation. I know that we are talking about temporary basic income, but you touched upon the idea of having a kind of a basic income maybe beyond being temporary, post-crisis or something. I'm interested to know your view about the impact of that on inflation rates and whether, I mean, it makes sense for most countries or not. Thank you very much.
And George, we have another question. Would you rather take questions one at a time or do them in batches?
Let's do them in batches, I think. That'll be better.
All right, fantastic.
Thanks,
so,
Sarah.
You're welcome. So Turner, I'll ask you to unmute and ask your question.
Hi, George. Thanks for being here. My question is about, you talked about identification and enrollment and how hard that is. I'm curious about, in Togo in particular, what strategies you might have considered but didn't use, and why you chose the ones you did.
Great, and we have, I'll add one more question to this batch. So Felipe is asking, should TBI be paid by long-term debt or by increasing taxes?
All right, thank you so much. Let me start with the last one because that's the easiest one. Well, not that it's easy in particular because the political economy is difficult, but as you can imagine, temporary basic income is temporary. It's based on a shock, so we wouldn't go for taxes, no increase in taxes. Most countries are actually doing it through repurposing expenditures right now. And that has, of course, an effect as well, because it means repurposing expenditures that probably went to investment and that were earmarked to investment, and they go into current expenditures like this, like income support. So over the medium and long term, this would have to be funded through debt, and that's partially what was behind the benchmark that we used with the DSSI, the G20 debt moratorium and debt service suspension initiative. So there's a conversation going on. The G20 is actually having that conversation next week. The idea is to extend the moratorium, the DSSI, till the end of 2021. And if that happens, that will liberate a lot of money for low-income countries to use, not just for this, but for other measures. So it's within the ballpark, and that's how countries are funding it right now. Now, let me move to the second question that Turner had, which is the identification enrollment issue. And that's a tricky one. I think what we've seen is learning by doing. So different countries are using different strategies. Some countries like Togo that didn't have a very strong registry system to start with were not able to use very sophisticated identification strategies. So what they used is geolocation, and they used that as a proxy of being eligible for this kind of transfer. It's not quite universal in Togo. What they're aiming at is all poor and vulnerable households, which is still 60% of the population. But so the question is, how do you identify those? And what they did is they focused on geographic location, and they created thresholds. So people would send out an SMS, and that SMS would be geolocated. And that was the filter that they used for this during that window of registration. There's many ways to trick the system. I mean, people can move around from neighborhood to neighborhood or from community to community. So a second filter that they used is community surveillance, because rural communities have their own lists of people who are in the agricultural community or cooperative and so on. So that's how they ended doing that. But in other countries, such as Colombia, for example, with Ingreso Solidario, you get more sophisticated funneling systems. So the way that they did it is they already had sort of a universal registry. And what they could do is they could use biometric printing, which they already had for people, and then verify that through digital means. So they expanded very quickly to rural municipalities, which they thought needed and demanded this more than others. So that was also something that's been going on. As you can see, all of this is sort of, there's a lot of error that is induced by this. So it's not the best case scenario, but it's all happening during crisis, second best, if you will. And then finally, the big question on the UBI, and when you think about UBI and the effect it has on the expected effect it might have on the price level, is that sort of the modeling exercises suggest that if this was generalized, then you would just see a general increase in prices. But so far, what we've seen from studies are localized UBIs. So no country has done a full UBI yet. We haven't seen the evidence for a full effect on inflation. But I think that's probably right. We'll probably see sort of a tempering out of the effect over time. And that's why a lot of the discussion is now focused, perhaps, at least what I've heard, is focused not so much on the universal side, but on certain subgroups of the population, especially those that are not joining the labor force, those who are outside the labor force for either permanent reasons or for temporary reasons. And there's a discussion. You can take a look at Banerjee's latest paper in Kenya. They have an RCT in place, and they took a look at the effect of the UBI during the COVID crisis. And it's sort of an interesting result. They don't look at price levels, but they look at some other intermediate outcomes and find that income support is useful. But they also find that it doesn't have many other effects. So the short-term effects are income, but not much more right now. It's not human capital. It doesn't have the other desired effects that you might expect in a longer-term agenda. So I think that UBI debate is fascinating. My colleague Ugo Gentilini from the World Bank has a fantastic book that I recommend you take a look at, sort of scoping out different types of typology, if you will, of UBI, and I subscribe to his typology. But I think there's so much more that will be discussed and researched on this agenda.
Great, thank you. For the next batch of questions, please feel free again to raise your hands. So I have the first question here is from Elizabeth. Elizabeth asks if you have looked at cost savings consequent to transfers, for example, in healthcare or reduction in crime. And if anyone else has questions, please again, remember the chat is open and you can also use the raise your hand function. And then I would actually like to ask a question myself. So have you seen, and you've been kind of talking about some examples with Togo and Colombia, but are there other country examples that you've seen that have worked really successfully using temporary basic income transfers? And maybe what are some of the key components of those?
All right, thank you. Thank you for both questions. Let me start with the first one from Elizabeth. What we are looking at right now is the effect of income support actually on the effectiveness of lockdown and of the spread of the virus. So there's an ongoing study by our team focusing on that, because sort of the hypothesis is if you can guarantee a basic income, then people who are in the informal sector might have an incentive to stay home at least, and not be out daily on the market as they were without an income support. So that's what we're testing right now. But what you suggest is something that is also being tested in more advanced economies. So there are studies going on the effects of crime and also on healthcare in New York City, where I'm today in West Virginia, but I usually live in New York City, and there's already some studies happening, taking a look at that and seeing the effect of what happened when the $600 per week transfer stopped on the 31st of July. So that's ongoing. That's happening August, September, October. I guess we'll see the results over the next few months, and I find that fascinating. This is truly an experiment, if you will. The shock hits, very heterogeneous effects in different countries and different cities with different responses. So there's a whole field of studies that can emerge from this natural experiment, if you will. And then on what you just asked, Sarah, I think there are some, so I would say some of the most interesting experiments right now on temporary basic income are emerging from places like Tuvalu in the Pacific Islands Ocean, because what they did is they implemented a full UBI for the 11,000 people of the whole country. It's a micro-state, but so we'll find out over the next few months what that effect has been, but we already know that the effect on the one hand has been zero contagion, because they've been able to create an incentive for social distancing. They did have cases that were imported in the very beginning of the crisis in March and April, but so they stand out as an interesting case. And then in the advanced economies, of course, the one that's brought most attention is Spain. So Spain introduced something that is a temporary basic income for all of those people who were not covered by the existing social insurance and social assistance scheme. And they intend to extend that beyond the COVID period indefinitely into the future. So it's a UBI in the making, if you will. And I think that's a fantastic case to take a look at and see what the effects are around the world. But there are many, many other cases. I'm thinking of Korea, Japan, that also implemented TBIs. So there's 132 countries right now with some sort of income support measure that uses temporary basic incomes.
Great, thank you. Yeah, and you used that great map that you showed us earlier in the presentation. So that's helpful to have some key examples. We have another question from Kristen. She asked, how do you think TBI may impact investments in education in countries, especially in regards to repurposing of expenditures? And as I mentioned, if you have questions, please raise the hand and add to the chat.
Yeah, I think that's a great question. So the effects on education and health are something that have to be monitored. What we've seen so far is that we haven't seen repurposing away from education or from health. Those two sectors, at least, are running strong for most developing countries. But what we are concerned of is that the fiscal space is shrinking. And as fiscal space shrinks, what happens is you start to divert resources first from investment to current expenditure, but then you start to divert from other sectors like education into the emergency sectors. So we can already see that if we don't have other provisions in place to create either debt restructuring or debt moratoria, then there's going to be 50 or 70 countries that will dip in, not just to education, but as you've seen perhaps in the case of Peru or even Chile over the past few weeks, into the pension funds and using sort of the contributions from pension funds as an income support measure during the emergency. So those are things that can erode the long-term human capital building side of this, as well as protection systems that move beyond income support. And I think that's something that the ILO is looking at, we're looking at, UNICEF and so on. But so far we haven't seen evidence of moving away from education. I should say that the impact of the slowdown and of children and youth leaving education and stopping education is massive because of COVID. And I think that will linger on for years in most of the developing world. So that's a big issue. And as you know, most countries are not able to do teleeducation. So they're using radio, they might be using television, and some have just stopped totally. So we have a crisis unfolding right now on the education side.
Great. So I think those are actually all of the questions that we have one additional question from Rodrigo. Rodrigo is asking, what is the typical size of the fiscal effort TBI would entail? And their guess is that it can be so large and restricting to be useful. So have you thought of ways of people self-selecting into the system only as a resource for last resort? And then another question are, what are the next steps to a report such as this?
Okay, so for Rodrigo, I think that it's a good question. What most countries are actually doing are not going universal. What they're doing is expanding existing administrative registries, existing cash transfer systems. So what we did in the study is we looked at the ceiling. What would it cost if you went universal? If you focused on, well, not universal, but all poor and vulnerable people in your population. So with that measure, we find that the global number is 1.6% of GDP, of developing country GDP. But as you look at countries individually, it ranges mostly between 0.6 and 1.2% of GDP. Now, mind you, most countries are already spending about 2% or expanding 2% of GDP right now, between 2 and 4%. So it's a big number. And that's why we tied it to debt moratoria and to debt servicing, because we know that there is no fiscal space available. And of course, this is the critical question that every country is going through right now. What will you cut down? You know, are you going to take money away from health? Or are you going to take it away from income support? And that will play out differently in different countries. But we know that that's sort of high on the poll, if you will, on the priorities that most countries have. And finally, on this agenda, sort of what is our next move? We're going to be focusing on this for a while because we think that the income support issue will be happening over the year or so, year and a half. What our own concern is that we will see a dip. We'll see people sort of graduate prematurely from TBIs around the world, and we'll see a new U in the labor market in income support. There's a particular interest in our group to focus on female labor participation. So we're partnering up with some colleagues in universities and think tanks just to focus on female labor participation effects. And we already know from early surveys that up to a quarter of women, working age women, are expected to leave the labor force, at least temporarily, during this 2-year period. So this is very large. So the gap is very large between men and women on this. So that's something that is of concern. And the final thing is we're focusing on how this links to social insurance. So we'll try to think about, so what is the social insurance architecture that could take the place of a TBI in the future? You know, 2 years, 3 years down the road, what would it look like? Because that will probably have to take that will probably have to happen in most countries around the world. It's not really feasible to roll out a TBI every couple years. This is an emergency measure, so that's how we see it, at least right now. Thank you.
Great, and I think we have time for just one final question. And Laura asks, what variables or mechanisms should we use to graduate people when a country has a big informal sector?
Yeah, the key thing, I mean, sort of the rule of thumb that we're following in the UN is that the only way to really put a threshold on this, or sort of to find a ceiling on this, is when we have full vaccination for our population. So as I said, the graduation scheme that we think is optimum shouldn't be happening right now. It should be happening once we have, 40%, 50 or 60%, which would be sort of the World Health Organization herd immunity estimate. Once you have that percentage of the population inoculated, then you can go into full graduation mode because labor markets will be able to reopen. So we think that's about 18 months away. And frankly, most countries, I would say 90% of countries, are ready to get off income support right now because it's a big fiscal burden. So this is going to be a big issue. We think it's going to come back in the advanced economies and also in the developing economies. And for informal economies, as you know, people are going out to the market every day. They're not waiting for lockdowns or for containment or for suppression of the virus. They need to survive. So we've seen that play out in India, in South Africa recently, in Brazil, in Mexico, and it will continue to happen as long as we don't have full vaccination. So that's unfortunately, sad to end on a sad note, but that's sort of the horizon that we've got. We've got to stick to the next 18 months and focus both on the health and on the income side. Thank you.
Wonderful. So thank you very much, George, for your presentation and for answering all of these great questions. We really do look forward to seeing additional work and diving a bit deeper into this report. And we hope that the rest of you will join us next week for the CID speaker series with Michelle Ruta of the World Bank Group. And thank you again for joining, and we look forward to seeing you next time.
Thank you so much.